Okay. Good, good morning, ma'am. Good morning, sir. Good morning, classmates. Now I will discuss about anatomical review of the lumbar spine and the common injuries. When we say lumbar spine, it is refers to the region, the lower back area, especially the five vertebrates, which is from L1 to L5, that make up the lower parts of the spine. This region of the spine is responsible for supporting the majority of the body's weight and facilitating movements such as bending, twisting, and lifting. It is a common area for back pain and injuries due to its role in supporting the body and its flexibility. Lumbar spine is anatomy review, which is the five vertebrae are in the lumbar spine. Lumbar vertebrae are the largest moving vertebrae. The major ligaments are the anterior posterior longitude. This lumbar spine consists of the five vertebrae in your lower back, which is your lumbar spine is located below your 12 chest, thoracic vertebra, and above the five fused bones that make up your triangular shaped sacrum bone. It is compared with other spine vertebrae. Your lumbar vertebrae are larger, thicker, and more block-like bone. Your lumbar vertebrae provides stability for your back and spinal column and allow for a point of attachment for many muscles and ligaments. Your lumbar vertebrae support most of your body weight. It is also center of your body balance. Your lumbar spine and the muscle and ligaments that attach to them allow you to walk, run, sit, left, and move your body in all directions. This lumbar spine is anatomy review with five vertebrae in the lumbar spine. Lumbar vertebrae are the largest moving vertebrae. The major ligaments are the anterior and posterior longitude. Your lumbar spine has several functions including support your upper body, distributes body weight. Your lumbar spine supports the upper two sections of your spine, 7 vertebrae in your neck, cervical spine, and 12 vertebrae in your chest, thoracic spine, and weight of your head. Your lumbar spine connect to your pelvis and various muscles of your body's weight, as well as the stress of lifting and carrying items. Your lumbar spine also transfer the weight from your upper body to your legs. The another one is move your body. The muscle of your lower back and flexibility of your lumbar spine allow your trunk to move in all directions, front to back, flexion and extension, side to side bending, and full circle, which is rotation, as well as twist. The last two lumbar vertebrae allow for the muscle this movement. It is protect your spinal cord and cauda equina. Your spinal cord, which is encircled and protected by the bones of your spine, starts at the base of your skull and ends at the first lumbar vertebrae. The vertebrae in your spine also provides a bony enclosure for the individual nerves that descend from the end of your spinal cord. The tails of nerves is called the cauda equina. It is controlled leg movements. These nerves that branch of your lower spinal cord and cauda equina control leg sensation and movements. This lumbar spinal region, where the sacrum consists of five vertebrae. The sacrum connects the spinal column to the pelvis. Right and left sarcoiliac SI joints are formed by the union of the sacrum and pelvis. Coccyx tailbone is the most distal portion of the vertebral is the most distal portion of the vertebral column. Lumbar spine region. Anatomy 5 vertebrae are in the lumbar spine. The larger moving vertebrae, the major ligaments, are the anterior and posterior longitude. Common sports injuries, which is also known as herniated or slip disc, occur when the soft inner core of the disc in the lower back or lumbar spine leaks out through the outer layer and irritates nerves. This can result in pain, numbness, or weakness in the lower back, buttocks, legs, or feet. Common cause of lumbar disc injuries includes aging, wear and tear, repetitive lifting or twisting motion, or sudden injuries like falls or accidents. Symptoms can vary depending on the severity and location of the injury, but may include sharp or shooting pain, tingling, or muscle weaknesses. Treatment for lumbar disc injuries often involves rest, pain medication, physical therapy, and sometimes steroid injection to reduce inflammation. In severe cases where conservative treatments do not help, surgery may be necessary to remove the damaged disc material and relieve pressure on the nerves. Spondylosis and spondylolisthesis, vertebral fracture, sprain and strain, lumbar and intervertebral disc injury. Note: any athletic suggesting history of acute trauma to the region or with significant pain or any numbness should be referred to a physician. These are the sample of spondylosis and spondylosis. It's a stress fracture in the neural arc pars interarticularis, compresses the articulation between two vertebrae. If the condition is bilateral, the affected vertebra can slip forward, resulting in spondylolisthesis. This vertebral fracture is a break of crack in one of the vertebrae, which are the small bones that form the spine. This fracture can occur due to the various reasons such as trauma from a fall or accident. Osteoporosis. It is a condition that weakens bones or certain medical conditions that affect bone strength. The symptoms of vertebral fracture can include sudden onset of back pain, limited spinal mobility, height loss, and in severe cases, neurological symptoms like numbness or weaknesses in the limbs. Treatment typically involves pain management, rest, and sometimes bracing or surgery, depending on the severity of the fracture and the underlying cause. Physical therapy may also be recommended to help regain strength and mobility. Such as fracture are common in sports. External blows may result in internal injury, deep abdominal pain, hematuria, blood in urine, and shock are signs and symptoms of internal injury. It is immobilized on spine board and is transported to medical facility. It is blows to the coccyx can result from landing on the buttocks. Fracture of the coccyx result in severe pain, point tenderness, swelling, and bruising. It is referred athletic to physician for evaluation. Sternal sprains. Sternal sprains are the most common soft tissue injuries in the lumbar spine. The major joints include the lumbosacral, sacroiliac, and sacrococcygeal. Strenuous pain signs and symptoms include the localized or global muscle spasms, pain that is not rooted into buttocks or lower extremity, acute postural abnormalities associated with the recent trauma. The first aid is have athletic maintain a comfortable position, typically supine with soft support for lumbar region and application of ice. If not improved in 24 hours, refers to the physician. Lumbar disc injuries is herniation result from the weakened annulus that allows nucleus pulposus to protrude through the wall of this annulus. Protrusion may put pressure directly on spinal nerves resulting in intense local or radiating pain, sensory loss or burning, tingling sensation in lower extremity, muscle spasms, and postural abnormalities. Lumbar disc injuries, the first aid may do is place athletic in most comfortable position, support lumbar region with rolled towel or other soft materials, apply crushed ice to lumbar region, arrange for transport for medical facilities. The lumbar disc injuries is a serious form of soft tissue injury is a herniated disc. Most commonly occurs is at L4 or L5. Excessive can cause posterior lateral protrusion of disc. Excessive extension causes anterior protrusion of the sternum. That's all.